in sales currently. I've been in sales for probably the past 25 years. Started out in the service industry and got into the sales side of things. I'm currently in the funeral industry right now. I do a lot of volunteer work, like in different civic organizations that we have through the local town that I live in. Oh gosh, ever since I was probably 20 years old, I would imagine, maybe even before that. I always had the issue where, you know, floss, do this, do that, you know, brush, you're not brushing properly, you know, do a different toothbrush, that type of thing, and it's always been an issue. I always had discoloration in my teeth, and my mom thinks it may be because of that, where it decayed my teeth a little bit, and that could have been where that came from, but we're really not sure. My gums would recede. Every time I would floss, they would always bleed. I mean, nothing I did, rinse, mouthwash, you name it. They did this deep root cleaning, and they told me to buy these special tools, and I had a good investment in that alone. I probably didn't smile as much as I should have, and the other issue I always had was, unfortunately with periodontal and gum disease, is you always have bad breath as well. And it's not like I chewed, it's not like I smoked or anything like that. I've had friends of mine mention it, and it's like, what else can I do? And it was very frustrating. The dentist I was going to at the time, he came to me and he said, you know, if you were my patient 15 years ago, I could probably have saved your teeth. And basically what he told me is you have to have them all removed. Pretty well devastated because that was the last thing I was thinking of. I asked him what my options were, and he said, unless you hit the lottery, most likely a denture. And that was not something I was comfortable with, I guess is the best way to say it. Well, my wife's a hairdresser, and I stopped in her shop. She was doing a woman's hair who happened to be a dentist. And we were having this conversation, and she was overhearing as far as, you know, I have to have them all removed, what my options were. And through the course of that conversation, she tried to explain the All-On-4 to me. About a month prior to that, I went to a different dentist, an oral surgeon, and he talked about rebuilding the bone and the process with that and the expense as well, and it was totally unaffordable. Nervous, unsure, didn't know a lot about it. I just had the brochure to look at, and I really didn't have any material or anyone to ask how the process worked. When I met with Dr. Krakora and his staff, they reassured me that everything was good. I didn't have anything to worry about. They just made me feel comfortable. And they, to this day, they still make me comfortable even when I walk in the door. It was in November 2011 when I met with Dr. Krakora, and he explained to me, my wife was here, what he was going to do and the process of everything. And I still had a little bit of reservation. I didn't want to do anything over the holidays because I didn't know what to expect. So we planned it for January that year. Came in, you know, I was pretty well nervous still. The girls, you know, they took care of everything. Last thing I remember, I was out. Woke up and I had my teeth where he apparently removed them and put the temporaries in. And I didn't know that he had done that. Had no pain. He gave me medication for that. Never took the, you know, never did fill the prescription. So for the first 8 months, because I had really bad, I had a lot more bone loss than he anticipated once he got in there. So I had to wait a little bit longer before I got my permanent teeth in. Once I got those in, I was like, could eat anything that I wanted to. I didn't get my permanent until October, which ran into the following holiday. Of course, you have vegetable trays and things like that, and I can actually chew on vegetables, raw vegetables, radishes, carrots, things like that with no problem. So that was kind of the first part of it, and being able to go through Thanksgiving dinner and so forth. When it really hit me was when I was away out of town, and I was at a restaurant and I ordered a steak. And I'm sitting there eating a steak, and I'm thinking to myself, you know, a year ago I wouldn't be eating this steak like I was. I mean, I could only chew on one side of my mouth before. I can chew on both sides. It's just like having my teeth when they were 20 years ago. Talk with the folks here, understand what caused the problems to begin with, and how this is going to rectify the situation, and make sure that you're comfortable going in through this whole process. There again, I had some reservations about it, and I'm very thankful that I did do it. I'm on 4 years now, and it's been a great experience. The staff, as I said, Dr. Krakora, they've just gone above and beyond what they need to do here.